As COVID-19 cases across the country surged before the holidays, messages of concern from public health departments eventually became sighs of relief here in Colorado.
Pleasant surprise after Thanksgiving turned into even more pleasant surprise after Christmas and New Year's.
Dr. John Douglas is the executive director of the Tri-County Health Department. He says coming up with reasons why Colorado avoided a post-holiday spike isn't necessarily easy when so much is changing and it's hard to track the effects.
I think we feel relatively confident that personal behavior matters a lot, and relatively confident that restrictions, which are a double-edged sword, mattered a lot. But we can't really quantitate exactly how much. I wish we could.
That's in part because contact tracing couldn't keep up with the amount of cases over the last few months. So it's helpful when researchers like those of the University of Washington's Institute for Health Metrics and Evaluation chime in. Dr. Ali Mokdad has been studying disease trends throughout the country for years. More recently, the focus has been on COVID, and mobility data has offered an interesting theory.
After each holiday, we have noticed in our data, we have mobility data, that Americans stayed at home. So it was like dead silence after the holidays.
So while people here in Colorado and elsewhere were traveling for Thanksgiving and Christmas, they weren't then attending gatherings or events that would have made transmission higher. He predicts our case and death rates will continue to decline. Dr. Douglas is hopeful too, so long as vaccine distribution ramps up and relief doesn't turn into complacency.
That's probably the thing that's got me most concerned.
Liz Kodelik, 9 News.